Okay, so I think this might be one of the biggest problems we have here. This is Dr. Sean over at Fortis, and we are doing week 4 online lab case study number 1. Okay, I'll try and put it in the discussion, but this is a difficult one, and I'm going to tell you a few reasons why. One, it requires you to kind of diagnose, and that's ridiculous. But anyway, let's read through this real quick. Mark Swanson went to bed at about 11 p.m. after a busy evening and entertaining friends and family. So let's pretend he had a bunch of sugar and he had a bunch of drinks. He woke up at 2 a.m. with chest pain that radiated to his left shoulder and fingers. This is a stereotypical discussion of heart issues. Okay, so usually heart attack will show up as shortness of breath, SOB, can't breathe, sweating. These are all possibilities. It doesn't mean you have to have them, and I'll tell you why in a minute. Sweating, chest pain, radiating, maybe. Could be just chest pain. Heaviness in the chest, pressure in the chest, a sense of impending doom. That's a big one, I'll tell you in a minute. Chest pressure, pain in the shoulder, back, neck, chest that radiates down the arm, maybe to the fingers, okay? Here's why chest pain that radiated to his left shoulder, arm, and fingers. This is pretty stereotypical. Son took him to the emergency room department where he was immediately given oxygen by mask and nitroglycerin. Nitroglycerin, I have some. I keep it with me. And nitroglycerin is a very, very tiny little pill about yay big. And you put it under your tongue and it stings, this little bitey kind of thing. And what it does is vasodilates. So it opens up dilation, like your pupils dilate when you see something like the vessels around the heart will open up and your blood pressure will drop, reducing the amount of effort that the heart has to put to pump. Okay, so if it's clogged, it's trying to push some blood through these pipes that are kind of like tight and it's hard to get through. So we have to open them up, and nitroglycerin does that. Chest pain was relieved in about 30 minutes. An ECG, electrocardiogram, they used to be called EKGs because cardio in Austria, where it was invented, is spelled with a K. That's all. Revealed evidence of myocardial ischemia. Ischemia means that the heart muscle was not getting enough oxygen. Okay, but no evidence of infarction. Infarction means death of the muscle. I had the same thing. I had the same thing back in January. It started about the same. It started about 11:30 at night. I was kind of like having some pain, but I only had pain right there. No shortness of breath, no sweating, no, it was called diaphoresis, right? We had none of that kind of stuff. He was admitted under the cardiac intensive care unit for further evaluation. I ended up having 2 stents. Let's see what we got. Can we go here? I'm seeing if I can go to the next part. Bonk. Oops. Bonk. I'm reading everything through here. Okay. Strain in the shoulder. Is it done through here? Oh, where's it at? Hang on a second. I'm looking. I got to do a couple other things. Sorry, looking through these things. Where is it at? No, just trying to look for stuff. Okay, the following most cause of pain. But this is the terrible part. I think this is what a lot of people got wrong. Strain of the shoulder and arm muscles. That's the first of your what's called differential diagnosis. If there's no shortness of breath, or EKG or ECG shows normal, their blood tests, which measures a blood factor called troponin, which is a kind of protein that your body releases when there's injury. And like if you got punched in the face, your troponin does go up. There's a few other ones you can also measure. That's a big one. It'll go up to like 100,000. What is this one called? Virtual Lab 4, I think. Let's see if I can find them. Study heart cancer. Okay. Yeah, this is, I hate this one. Most likely cause of pain. So we know it's not this. Okay, that's a inflamed valve. We don't know that you need what's called an echocardiogram, which is an ultrasound, and they do it right in through here, or they can go transesophageal, which is across from this the esophagus, which is your swallowing tube, right? Insufficient amount of oxygen available to the myocardium. That's my answer, right? That's my answer because that makes most sense. And this says constriction of the heart by a swollen pericardium. That is going to be the correct answer for this one. I don't like it. Pericardium will cause a sense of impending doom. That's kind of like the hallmark for that one. This one you would not know until you took an X-ray or MRI or CT scan or EKG. So terrible, terrible one. I do not like it, but that's the answer for this one. Okay, I'm gonna actually probably bonk that one out of time. So where does this go? Okay, which of the following refers to chest pain? Myocardial necrosis, death of the heart muscle. Shouldn't feel pain. You may have other issues like shortness of breath or tiredness, that kind of thing. Heart attack, that's myocardial infarction. Okay, myocardial infarction, same thing, heart attack. Angina pectoris. Angina means pain. Pecs, right? It pecs when you do push-ups and stuff. That's the answer for that one. Let's see if he's going to give us time. Is this one? See, I always forget. Yeah, this one you have to answer it and then it gives you time to go through. It keeps you online. I don't like it. That's the way it is. Which of the following explains nitroglycerin helps relieve anginal pain? So remember I was saying it's a vasodilator. Okay, it deadens the sensory nerves in the heart. No, it doesn't do anything with the nerves. Okay, the nerves, that's run by a part of the brain called the medulla oblongata, and it kind of sends down a little bit. Hey, keep your heart rate about this level because we're not doing anything. And then remember the SA node and the AV node and those kind of guys will receive information. Go poop, 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 contract, 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 and the heart muscle contracts all at once. Dissolves blood clots. No, that would be actually like warfarin and other Coumadin, and there's a bunch of clopidogrel and spironolactone, a bunch of different drugs that can help do that kind of stuff. Baby aspirin is one of the ones that we see can do that. So that's why a lot of times when someone's having a stroke or even a heart attack, you can give them an aspirin and say, chew this and swallow it, if they can chew, right? I just did CPR and stuff. It does not dissolve, nitroglycerin does not dissolve blood clots. Decreases the amount of pumping work by the heart. Now, vasodilator is nitroglycerin. When it's open up those tubes to pump blood, the blood can get through easier. When it can get through easier, that reduces the amount of pumping by the heart. Hate it. Hate it. Causes the muscle, the heart muscle to tetanize. Tetanic means like this. It doesn't. It does the opposite, actually. Oh, we got 3 out of 3. Okay, so that's the actual answer for that one. And we're going to let it go at that. That was like, oh my God, 7 minutes. Too much time for the heart. Anyway, talk to you guys soon. Look through the other ones. This is the answers. If you need to go back and do it, that's fine. Okay? Good luck. You guys are doing really good. I'm really proud of you. We'll talk to you soon.